we were lucky to be one of the first pharmacies granted permission to deliver COVID-19 vaccinations with the AstraZeneca vaccination. That in itself has provided some challenges. We were really excited to be part of this first step into improving the vaccine rollout. Things went well initially. Uptake was much better than what I anticipated. I had hoped to just baby step our way through it until we were functioning really well, but we hit the ground running, maximum bookings for the first few weeks. Then the government changed the recommendations for AstraZeneca from 50 to 60, which has caused a little bit of hesitancy in the community. So we've had a lot of conversations about vaccinations as well as doing the vaccinating, which has been going really well, and everybody's really accepting it. I hope the sooner we can all be vaccinated, the better off we'll be. In order to get our workflow right for the COVID vaccinations, we have basically implemented quite a straightforward system. Bookings, we were lucky with the prize from the People's Choice video that Trent accidentally announced as a full website upgrade. So thanks, Aaron, for being a great bloke and honouring that. So we got a new fancy website with online bookings, which the team at Guild Digital worked really hard and got us up and live for our very first day of vaccinating, so people could book online from day one. So between the online bookings and phone bookings, we do 15-minute consultations with the pharmacist, with the proviso that patients will turn up, do their reading, look at their consent forms, see the pharmacist, and then wait back outside. Because we're going one vaccinator and one patient at a time, it means that we have a limited number of people who are overlapping still waiting out after they finish. So we have enough space in store to set up chairs, a waiting area for people as they're coming in and as they're leaving. So we do have a bit of space for that, which was very well utilised in this instance. Our vaccination room was already set up and functioning because we'd been delivering flu vaccinations since March. So that was fine. We just now do the flu vaccines on other days to what we do the COVID vaccinations. Bookings have been really well utilised, and we've only had a couple of spare doses at the end of each day. The most important part when you're considering taking on the COVID vaccinations is to be realistic about how it's going to work in your store. So really think step by step, when the patient walks in the door, how am I going to treat them? Where am I going to put them? Where will they sit? Where do they get their information? Which staff members need to be trained? Who is going to have what roles? So that you can be clear and give the patient the best experience. And it just makes it much less stressful for your staff as well, if you've got a clear idea of what you're doing. And also to make sure that you're working hard to get those pre-bookings, because a really hard day is if you only have one or two people booked in and you need to try and use the rest of your vial. The marketing is really specific. The onboarding pack that you provided from CVAS as far as rolling out, all the steps that you need to undertake in order to get registered, all the websites that you need, it has the marketing resources in there that you are actually allowed to use.